America's war against drug abuse is shifting. Overdose deaths are falling, but beneath the surface lies a deep and dangerous undercurrent that continues to eat away at the nation's health, economy, and moral fabric. As of June 2025, the numbers show progress, but they also reveal cracks in a fragile recovery. There's a silver lining. According to the CDC, overdose deaths dropped to 80,670 in the year ending November 2024, down nearly 24% from the previous year. It's the lowest figure since mid-2020. But this relief isn't universal. Black and Native American communities still suffer disproportionately. The opioid crisis, driven by fentanyl and a growing list of synthetic drugs, is far from over. The DEA's 2024 fentanyl seizures, enough to kill every American, prove that the streets remain flooded. New psychoactive substances, nearly impossible to regulate, complicate enforcement efforts and treatment protocols alike. While deaths are down, usage is up. SAMHSA reports that nearly 48 million Americans aged 12 and older used illegal drugs in the past month, up nearly 2%. Over 145 million Americans have tried illegal drugs in their lifetime. Cocaine use is also rising sharply, part of a global surge that is hitting U.S. cities hard. The cost to America is staggering. Drug abuse saps $820 billion annually from the economy, much of it due to healthcare, crime, and lost productivity. Only a fraction of those needing help ever receive treatment, and hospitals are overwhelmed. Inside the criminal justice system, the crisis is a constant companion. 85% of incarcerated individuals have substance abuse disorders or drug-related convictions. Post-release overdoses and recidivism remain alarmingly high. Communities suffer too. Families are torn apart. Children raised amid addiction face lifelong consequences. And in cities where open-air drug markets have taken root, fear and frustration are growing. The second Trump administration has pivoted to a more enforcement-heavy strategy. Border crackdowns and massive fentanyl seizures are core to the agenda. The president has floated tariffs on Mexico and Canada, and even the death penalty for major drug dealers. At the same time, a massive restructuring of public health efforts is underway. The Department of Health and Human Services is consolidating key agencies, SAMHSA among them, into a new Administration for a Healthy America, AHM. The administration says this will streamline treatment. Critics argue it could bury addiction services under bureaucratic bloat. The 2026 budget proposes sharp cuts, $1 billion from SAMHSA, $3.6 billion from the CDC. That's raised alarms. Experts warn of consequences for overdose prevention programs and data collection, critical tools in this fight. To its credit, the administration is backing some recovery efforts. Programs like the Recovery Housing Program offer transitional support for those leaving treatment, but coverage remains thin. Just 1 in 5 Americans with opioid use disorder gets access to effective medications. Research is ongoing. The National Institute on Drug Abuse, NIDA, is backing studies on adolescent brain development and drug exposure. Harm reduction tools like naloxone have reversed tens of thousands of overdoses, yet the future of supervised consumption sites and similar policies is uncertain amid shifting political winds. America is at a crossroads. The drop in overdose deaths is promising, but drug use is rising. The national mood is hardening, and proposed budget cuts could undercut progress. In the words of one public health advocate I interviewed recently, "You can't arrest your way out of addiction, yet that seems to be the current course." The question isn't whether America has the tools to fight this crisis. It does. The question is whether we'll use them or let politics get in the way.